It seems the worst fears about the Omicron wave in the UK may not be realised. Britain has seen a surge of cases linked to the variant in recent weeks, but there are tentative signs the number of new cases may have peaked. Ollie Barrett joins us live now from London for more. Ollie, well, Britain is looking to cut isolation periods as it makes progress against COVID-19.
It is certainly under consideration. Boris Johnson, the Prime Minister, has confirmed that today, that this is something that he is looking at. Now, isolation has already been cut for people who get COVID-19 down from 10 days to 7 days under the current rules in the UK. If you test negative on day 6 and then on day 7 of your isolation, you are then released from it. But there are calls for that to be cut further, like in the United States, down to a 5-day period of isolation. UK scientists have been slightly wary about going in that direction. They do worry that that could lead to some infectious people being released back into society's circulation. But there is pressure on Boris Johnson to do what he can to ease some staff shortages in sections of the economy which are being caused by people having to isolate after catching COVID-19. And this is a measure which could mean that some people do get back into the economy more quickly and therefore may ease some of those staff shortages. It's something that's being looked at, as I say. Boris Johnson also under pressure from MPs in his own party to actually go further than that, given that the data is encouraging from Omicron and from COVID-19 in the UK at the moment. We are seeing that large daily case number, infections number, but we are not seeing a significant spike in hospitalizations or in fatalities. And so many Conservative MPs say that Plan B restrictions that are in place at the moment, when they expire or are next reviewed on January the 26th, they believe that those measures should then be removed entirely. And they also want Boris Johnson to come up with some kind of plan for what they are calling a Freedom Day or Living with COVID Day. They want Boris Johnson to set out plans for how the UK can move beyond the situation we're in at the moment, where every time a new variant is picked up that causes concern, that the conversation moves to restrictions or potential lockdowns. Conservative MPs want Boris Johnson to set out how the country can now move back to something like normality.
But there are still concerns, about strains in the government health system. And what sort of contingencies have been put in place?
That's right. The data is encouraging on Omicron and the amount of people that are ending up in hospital as a proportion of cases. But given that the variant is so transmissible, it has still caused a large number of people going to hospital at the same time. At the same time as you're seeing doctors and nurses off sick or isolating with COVID-19, the government has already drafted in the help of the military. There are several dozen military personnel working in hospitals in London at the moment to ease some of those staff shortages that we've seen. The military remains on standby to help elsewhere in the country if indeed that is required. We've also seen doctors and nurses encouraged back into the profession if they've retired or left work in the healthcare sector to try and boost those staffing numbers. The opposition Labour Party say that this is a staffing crisis partly caused by underfunding of the NHS and because of a lack of a proper staffing plan. The government denies that, insists it spent billions of dollars already boosting numbers of staff in the NHS and rolling out other support for it. But it is certainly, despite the encouraging data that we're now seeing from Omicron and suggestions that the peak may well have already passed here in London, it is certainly a difficult time nonetheless for the National Health Service because of those people ending up in hospital with COVID-19, other people ending up in hospital as they normally do at this time of year, and added to that those staff absences caused by COVID as well.
Good to know. Thanks very much, Ollie Barrett, speaking to us from London.